John Bell Edwards is under the room.
Good afternoon, everyone, and thank you for being here this afternoon. I have with me again Dr. Biu, who works for the Department of Health, Office of Public Health, and he will be here to take any questions related to testing. I want to start by thanking all of the state and local first responders, everybody out there who's working so very hard on this emergency, and I want to again thank our healthcare workers all across the state of Louisiana, whether they're doctors and nurses, respiratory therapists, I mean, you name it. A lot of really, really good work by selfless people has taken place across the state of Louisiana, and certainly particularly down in the New Orleans region. Last night, I requested a major disaster declaration for the state of Louisiana from the federal government, so I directed that request to President Trump in order that we might receive additional support for state and local agencies as we continue to combat the spread of the virus and deal with all of those individuals who actually have the disease, COVID-19. As we anticipated and as we stated, and quite sadly, the number of cases in Louisiana continues to rise more drastically than we would like. As of today, we have 1,388 cases and 46 deaths. That is 216 more cases than we reported at noon yesterday, and 12 more deaths since our report yesterday. I want to remind you that we are updating the numbers once a day now at noon, because it just became too much to try to manage with all the various testing labs and reports that had to be coming into the state and aggregated and to make sure that they were accurate and so forth. So we're going to do it once a day. Across the state, and this information is there for you. If you take a look at it, we have 1,252 individuals who are COVID positive. I'm sorry, we have 1,252 people in hospital beds that we're following. 271 of these people have tested positive for COVID-19. Another 981 have been tested or will be tested, and we are waiting for their results. So we call these individuals PUIs, persons under investigation. 94 individuals who we know have coronavirus, COVID-19, are on ventilators currently across the state of Louisiana. It is important to remember that with respect to the persons under investigation, that 981 that are currently in the hospital, if recent history holds true, somewhere around 60% of those individuals will test positive for COVID-19. The rest are in the hospital because of flu, other respiratory ailments that they have, and so certainly not all of these individuals, in fact, a minority of those individuals should ultimately prove to be COVID positive. But they are in the hospital, and they are taking up bed space because they need to be in the hospital, and they're using ventilators and so forth. So it is part of our overall challenge when it comes to delivering health care for those who need it. It's critical, and I've been saying this for some time now, and I know a lot of people are probably getting tired of me saying it, but it remains our number one priority, and this is where we're calling upon every individual in the state of Louisiana. It is critical that we do our part immediately. You can't fix what you didn't do yesterday or the day before, but starting right now and going forward, everyone has to do their part to reduce the spread of this particular virus. Everyone has a role to play, and I mean everyone. If we can preserve our precious healthcare resources so that they're available to provide care for each of us if and when we need hospital care, then that is clearly what we're trying to do. We have a critical window of time in order to flatten the curve, and that is why the stay-home order, which went into effect yesterday at 5 p.m., is so necessary. We must minimize social contact and slow the spread of the virus. Obviously, it was not a decision that I made lightly. I know that it is hard on people. I know that it's hard on businesses. on employees. I know that this is not what we're accustomed to, and I, like you, look forward to the day when we are past this. When that comes, I don't know. I can't give you a time frame on that. But what is essential now is that we do our part, flatten the curve, so that we extend the duration of this event and not have it peak all at one time, and people who are ill are presenting themselves to the hospitals, and we don't have the capacity to render the care that they're going to need. And in order to make this decision, I've done the very best that I could to look at what the science is telling us and to rely on authoritative sources like the Centers for Disease Control, and looking into the information that's being provided from the folks here on the ground, the Department of Health, the Office of Public Health, talking to our hospital CEOs and so forth. But I also have had the opportunity, and I thank them for it, to have personal conversations with individuals such as Dr. Brett Giroir, an admiral in the U.S. Public Health Service, but also the Surgeon General, Dr. Jerome Adams, and even had a conversation the other night with Dr. Anthony Fauci. When we maximize the use of science to inform our decisions, we minimize the role of politics in the decision, and that's what we're trying to do here. There simply isn't any room for politics in this. So I need for people to take the order seriously. So far, I've actually been encouraged by what I have seen. The mitigation measures that we are taking now will pay off down the road when we see that curve begin to flatten and the demands placed on our healthcare system reduced. So I ask everyone, before you leave your house, is the trip that you're about to make important? Is it essential? Is this the second trip to the grocery store today? Can you wait till tomorrow, the next day, to go? And certainly this doesn't mean that you can't go outside at all. You can. You can go out, you can exercise, spend some time outdoors in your yard, take your dog for a walk, and so forth. And I understand that if you're an essential worker, and we identified those in the order, that you're not going to be able to stay home. And I want you to know that we're grateful for everything that you're doing, even as you travel to and from work, and what you're doing at work in order to practice social distancing and minimize contact and the spread of this particular virus. I also appreciate all of the employers, private and public, who have instituted large numbers of telework, people who are working from home, off of their computers and otherwise. That is very, very helpful. Right now, I think it's just imperative that we change our mindset on what it means to be a good neighbor. Being a good neighbor right now means staying at home, stopping the spread, and saving lives. Doesn't mean you don't check up on your family and friends and your neighbors. Give them a call. Get on FaceTime with them, Skype with them. I also want to remind you that we're placing all of our updates on the COVID-19 situation on our website. We have a dedicated page at gov.la.gov/coronavirus. gov.la.gov/coronavirus. Having and sharing accurate information is important for all of us right now. There are a few other ways that you can also be a good neighbor. The first is to donate blood. Our blood banks are in desperate need of donations. If you are healthy with no symptoms, I urge you to consider donating blood and giving that gift of life. And please understand that it is both safe to give and to receive blood. The second way you can help is by donating to a local food bank. Food banks are in dire need right now as well, and they need money most of all. And you can do that from home. Every dollar can provide up to 4 meals. This is something you can do from your couch without leaving the house. It also allows the food banks the flexibility to get the items they need without impacting the supply chain. I know that many people do not have the means right now to give, and that's understandable. But if you do have the ability to donate without causing a hardship on yourself and your family, please consider making a monetary donation to your local food bank. And these donations can be made through Feeding Louisiana at bit.ly/LA COVID donate. And we'll have that information up on the website for people too. Finally, while everyone is spending more time at home, and some people are going to be looking for some things to do, I'd encourage you to go ahead and get on the computer and fill out your census. Let's get that information turned in. Obviously, it's not the most important priority, but it is important. And I'm reminding people, the notices from the Census Bureau went out a couple of 3 weeks ago. Most families should have them if you have the opportunity to complete your census. Please go ahead and do that. Before I open up the floor for questions, I want to remind everyone that today, for me at least, and for like-minded individuals, is a day of fasting and prayer. I've told you quite often I believe in the awesome power of prayer, and I want to thank everyone who has joined in on doing this along with me today. And my prayer is for the healing of those who are ill, protection for those who are on the front lines of our healthcare system, and guidance for all of our nation's leaders, that we can navigate this crisis together for the good of all our people. And I want to thank everyone again for being here today, and I'm ready to take your questions. Yes, sir.
Governor, last week you said the New Orleans area was 7 to 10 days away from running out of capacity to deliver healthcare. In the disaster declaration request, I think you used the date April 4th. Can you talk about what's changed in that time frame? What looks better for us right now? I assume there's updated modeling.
Well, first of all, better is very, very relative. And if you remember last week when I said that, it was the first effort at modeling that we had, and much of it was based on data that was relatively new, and that it was a worst case scenario. So as we see the growth rates, as we see the number of COVID positive patients who have to be hospitalized, as we get a better idea of the percentage of people hospitalized who are going to need an intensive care bed and a ventilator, as we get a chance to see what the average stay in the hospital is going to be, then we're able to refine our estimates through the updated modeling. And so what you are referencing today, when we're pushing out the date in Region 1 down around New Orleans, where we think we might exceed our capacity to deliver health care to COVID-19 patients, it would be in the April 4th or 5th timeframe. And as you can imagine, for the reasons that I just stated, that is going to be refined every day. It is my hope, it is my prayer, it's the reason we implemented the mitigation measures, the stay-at-home plan, that this curve starts bending, because that's the most important thing. And I don't want the people of our state focusing primarily on the surge capacity. We're doing everything that we can to increase that capacity. But what I want people focusing on are the things that they can control, and that is themselves, and whether they fully comply with the mitigation measures that we have in place around social distancing, stay at home, and so forth. That is the most important thing for people to focus on. This is two parts. We have to flatten the curve so we don't put the demand on our healthcare system all at once, and we have to increase our capacity within that healthcare delivery system. Yes, sir.
Kind of following up to that, you talked about the models and the forecasting, the data and the models that you have right now. What is that possible overcapacity, that overwhelming? What is that going to look like? What does that necessarily entail should Louisiana reach that?
Well, first of all, it's obviously would be something that would be terribly unfortunate, because we know that the overwhelming majority of people who receive care when they need it and that is appropriate to their condition, they're going to survive this. If we overwhelm our capacity to deliver that care, then we're going to have less people who will survive that could have. So obviously that is the worst possible outcome, and that is why we have to flatten the curve and surge our capacity to deliver health care. But this is the exact same situation that is playing out in multiple places in the country right now, and I know that people saw the governor of New York this morning, for example, talking about this, but you've seen it play out in other places around the world. That's what we do not want to happen here in Louisiana. And while we're still on the trajectory that we're on, we have still the third highest case count per capita in the country. While we are on this trajectory, we have to be intensely focused on doing what we can to flatten the curve. And that is, if of all the messages that I deliver to the people of Louisiana at these press conferences, that is the single most important thing. It's why we've done the mitigation measures. It's why we're asking everyone to comply. Don't go out if it isn't essential. Minimize contact. Practice all the measures that we've talked about. They remain important. And we don't necessarily repeat them every time. But it is still important to wash your hands frequently for 20 seconds with soap and water. If you don't have access to soap and water, use hand sanitizer. Stay 6 feet away from people. Make sure you control your cough. If you are sick, do not get around other people. And understand that the most vulnerable people in our state remain those who are older and those who have chronic health conditions. And so, you don't have to use your imagination to know what this looks like. You can see what's going on in Italy. That's what it looks like. And nobody should say, well, that's Italy, it won't happen here. Well, for what reason? Would anybody believe that if we don't flatten the curve? Yes, ma'am, in the back.
We saw that there were short lines at the drive-through testing center today in Baton Rouge. What are your thoughts on that, and do you think that's a good sign of what's to come next?
Well, first of all, I don't have any thought relative to whether it's a good sign as to what comes next. Until the curve starts to flatten, I am not going to draw an easy breath. It is just that simple. But I can tell you our testing has ramped up across the state in multiple locations. I think we have over 8,500 tests. I think it's 8,603 test results total that are informing our case count today. That's up from 6,000 yesterday. This is a good thing, because you never want to be in the blind about what you're dealing with. The more testing that we have, the more results that come into our data, the better the decisions that we can make about what we're facing. I really appreciate the efforts that have been made here in Baton Rouge, but also all around the state of Louisiana. We're seeing many more entities like hospitals doing their own testing in-house. We're seeing drive-through testing in New Orleans at 2 stations and 1 in Jefferson Parish, but it's also opening in Lafayette at the Cajun Dome, and it's going to be open soon in Lake Charles. And so the more testing, the better. This is the one thing that South Korea did that really helped them to flatten the curve. They had much more testing capacity early on, and the throughput lab capacity to get those results out and get people into isolation, get people into quarantine, and do the contact tracing. Why is this important? Because people who become symptomatic today might have been exposed a week ago, 2 weeks ago, 3 weeks ago. And that's why it's going to take some time for us to know what that curve is doing. Even if everyone is practicing perfect social distancing today, it's going to take a while. And so we have to be patient with this. We have to stick with it until we know exactly what's playing out. Yes, sir.
You've talked about Louisiana having the fastest growth of this
Yeah.
in the world, third highest per capita in the country. Have you been given any reason or maybe a list of factors that have contributed to it being much worse here than in other parts of the country and the world?
No. I will share with you a theory. I'm not an epidemiologist, and the studies haven't been done, obviously. But the first confirmed case in the state of Louisiana, the first person who tested positive did so 13 days after Fat Tuesday, and did so in the New Orleans area. And if you look at how long it takes from exposure before people becoming symptomatic and starting testing positive, that's the period you're talking about, between 2 and 3 weeks. I happen to believe, with people coming from all over the country and all over the world into New Orleans, that a fair amount of coronavirus was seeded in that area, if that's the right word. But that is a theory at this point. It may or may not prove correct. But what isn't a theory, what is fact, is what's actually happening on the ground. And we know that it's serious. We know the case count is much, much higher than we obviously want it to be. And we haven't yet seen the trajectory change. with respect to our growth rate. And so those are the things that we're focused on. At some point, somebody's going to get a doctoral degree because they're going to do a study on this situation as it relates to Louisiana and so forth. And I'll be interested in reading it. But until then, we just have to deal with the facts. Melinda and then Greg.
Governor, President Trump today talked about he wanted the economy to be back up and working by Easter, which is less than 3 weeks, and he seems to be tilting more towards wanting businesses to reopen. Do you think that's a realistic timetable for Louisiana, or is that too optimistic?
Well, I think it may be a realistic timetable for certain places in the country. Until we see the curve flattening and we can see daylight at the end of this tunnel, it's hard for me to pick a date on the calendar and say by this date we believe we're going to be out on the other side. Look, nobody wants people to go back to work more than I do. Nobody wants these businesses to open. Nobody would love more than me for this to play out between now and Easter, and on the Monday after Easter, which is, by the way, is the day that my proclamations expire. But I have every intention of looking at the facts as we approach April the 13th, and if necessary, we will extend some or all of the measures that we've taken. And quite frankly, it's hard to see the economy coming back and businesses opening in a robust fashion and people resuming their visits to Louisiana and tourism picking up where it left off if we are struggling to deliver health care in the state of Louisiana. And so I think the best thing for us right now is to focus on these mitigation measures, making sure that they are effective. And to the degree that we are successful, we will hasten the day when we can reopen all sectors of our economy and get things going. Look, we had the 4th fastest growing economy in the country when this hit us. I want that to happen too. But my first priority is for the health and safety of the people of Louisiana. And we're going to rely upon science, we're going to rely upon the CDC, we're going to rely upon the advice that we're being given by the medical community as to what we need to do. And until we tackle the medical challenges in front of us, it is very difficult for me to see the economy coming back under any circumstance. Yeah, Greg.
It seems less and less likely that school will resume this year. If it does not, will those students be, all of the students, testing has been waived, will they be passed along to the next level?
Yeah, I don't have an answer for you on that question. It is a good question, and I'm not trying to dodge you. I just haven't heard from the Department of Education and what their plans are, and I know they're going to be working on this going forward. Right now, we have not called off school for the rest of the year. They're scheduled to reopen on April the 13th. That may or may not be possible for the reasons that we've been talking about here this morning. And I know that Beth C&O, the interim commissioner the interim superintendent for education in Louisiana, she's working right now with her staff and with the Bessie board, with all of our district superintendents and so forth, to figure out what happens under 2 or 3 different contingencies. One is school resumes on April the 13th. The other is school resumes at some date subsequent to that. And the third one would be that it doesn't resume at all during this current academic year. And when they have more information, they will be sharing that. Until then, I do want to remind people what we've already done. And I have, by executive order, suspended the statutory requirements related to end-of-course testing and LEAP testing, evaluations and school letter grades, the instructional minutes that each school has to offer, the number of days that students have to attend, and so forth and so on. And it is my understanding that we have received the waiver necessary from Secretary DeVos, the U.S. Department of Education Secretary, because under the Every Student Succeeds Act, we actually have basically a contractual agreement with the federal government that we will engage in all of those measures that we have suspended. And so I don't want anyone worried that they're going to have to go back to school and take a LEAP and pass a LEAP test and so forth. But as far as promotions and graduations, we have information coming out on that hopefully soon. Beth CNO will relay that information. In the meantime, I'm encouraging every parent, every caregiver out there who has a student at home to make sure that that student is engaged in reading, in instructional materials, distance education if it's available. There are many, many resources available, and this is being communicated to parents, to teachers, to schools from the Department of Education and from a number of sources. You know, I did a program at LPB last night, and I know that LPB, for example, has greatly ramped up the resources it's making available, including instructional programming on TV. And so this is all important so that we don't see a lot of regression in our students for the time that they're going to be out of school. And I know that this is very disturbing to some people to have schools closed and to have these students at home and not in the classrooms, and it disturbs me as well. But it is part of the approach that I believe we have to take if we're going to slow this spread and preserve to the maximum extent possible the health and safety of our population. Sam?
Governor, the state's identified 2 clusters so far of coronavirus cases, one at the Lambeth House in New Orleans and one at Chateau DeVille and Donaldsonville. Can you give us an update on how many cases are at those 2 nursing homes? And also, do you know which other nursing homes have been affected by coronavirus in Louisiana?
I am going to ask Dr. B to come up and answer those questions, and we'll see what he knows today.
Thank you, Governor. To your first question about Lambeth House and Chateau DeVille, Lambeth House, our understanding of the total number of cases, as far as I know, is still 42. We have unfortunately had 2 additional deaths for a total of 11. As you noted, we have learned of 5 cases at Chateau DeVille. We have additional clusters at Chateau de Notre Dame and St. James Place. And I believe St. James Place has 3 individuals, and Chateau de Notre Dame has 1, but I may be getting those backwards.
Where are those located, Doctor?
I believe St. James Place is in Donaldson, or
St. James is in Baton Rouge, and the other facility is in Donaldsonville.
And sorry, you said all of those were clusters, but the Notre Dame facility only had 1 case?
Yeah, so there may or may not be a worker involved, and so that's why we're still investigating. I think that the main point there is my team and our team across the state Office of Public Health. As soon as there's someone with symptoms in a facility like this, we engage that organization. So it doesn't quite meet the bar of a cluster yet, but we're already working with them, trying to find out, are they taking the right measures? And I'll say that what we've been seeing from the nursing homes and similar facilities across the state is being very proactive, taking seriously our restrictions on visitation, trying to be creative about ways to keep families connected, which is, I think, critical in this time of staying at home. And so often by the time we're reaching out to them, a lot of the measures we're going to recommend, many of them are already taken on board.
To be clear, this is the entire list of facilities where you have known coronavirus.
As I have it.
Nursing home facilities.
And because we have these issues that Dr. B just mentioned, yesterday we renewed our request for an epidemiological team from the CDC. That request has been granted, and we hope to have them on the ground here in Louisiana very quickly to help us manage these particular situations. Yes, sir.
As far as FEMA goes, I know they've had a more national response in the past couple of days. As far as Louisiana goes, kind of what role is FEMA playing, if any? And then obviously we have a lot more cases than many states. Has our response also kind of been, as far as testing being ramped up and other things, been a little bit faster because of the number of cases we've seen?
Yeah, I'm not able to compare and contrast what we're doing in Louisiana with respect to other states, and I apologize. I just can't do that. I will tell you, the testing has ramped up in Louisiana considerably. As I mentioned earlier, 8,603 tests are informing our data today. It was 6,000 yesterday, and even at the state public health lab, the capacity has greatly ramped up. And early on, and one of the reasons that our numbers were skewed is we were testing people who were basically in the hospital with symptoms and they needed to be hospitalized. And so you saw a large percentage of the tests being administered coming back as positive, and a large percentage of people who were positive being in the hospital. As we get more tests informing our data, more test results informing our data, then we're going to have a smaller percentage of people who are positive and a smaller percentage of those who are positive that are going to need hospitalization. And that's the information we need to really know what trajectory we're on with respect to when we might eclipse our ability to deliver critical health care. Now, but I'm not able to compare and contrast what we're doing with other states. Yes, ma'am.
Whenever you submitted your request for a major disaster declaration, you wrote that you had grave concerns for our healthcare workers, our emergency workers. Was that the tipping point for you asking for this assistance? And also, have you heard a response back from the White House?
We have not yet. We believe that FEMA Region 6, which is where we route these requests to, they support the request, but ultimately it has to get to the White House and be favorably acted upon by the president. I do hope, I actually believe that that's going to happen sometime in the near future, and it should make available to us more resources. And I'm going to say something, I am not diminishing the challenges being presented in any other state. Whether it's New York or New Jersey or Washington State or any state out there. I just don't want the federal government or anybody out there minimizing the challenges we have here in Louisiana. As I mentioned before, the trajectory that we're on is very problematic. The growth rate that we're seeing, very problematic. Number 3 in the country in terms of our per capita cases. And the reason this should inform decision making about whether we are granted a major disaster declaration and the resources that then flow to Louisiana as a result of that is any state's healthcare system is sized to meet the needs of a given population. And so more than anything else, it is the per capita case number that indicates whether you are moving in a direction that can exceed the capacity to deliver health care. And so that's why we've asked for this declaration so that we can get more resources, whether it's beds, whether it's staffing, whether it's PPE, ventilators, you name it. But the things we need here in Louisiana are not different than things that are needed all across the country. And again, I've said this before, and I hope people will understand what I'm trying to communicate. That's what makes this disaster, this emergency, so different than others that we have faced. If we have a natural disaster, a hurricane, a tornado, a flood, then that's really bad. But it doesn't affect the whole country at once. And so the federal government can really focus on the needs of Louisiana in that situation. And we're able to put in requests to sister states. And we love to help one another. But right now, there's not a lot of help forthcoming from other states on our critical needs because these are the critical needs the other states have as well, and they're keeping those resources and those people to meet their own needs, and I fully understand that. But that's what makes this particular situation so challenging. I believe a major disaster declaration would be helpful in order to get the resources that we need to better cope with this emergency. Melinda?
Governor, in that letter you talked about trying to use hotels in some sort of hospital capacity. Have you started conversations with hotels, and and can you explain a little further what you're talking about and what you see happening in those spaces?
Yes, well, the conversations have started, and we're looking at multiple options, and obviously we have to move very quickly, and we're going to have some announcements forthcoming. I'm not exactly sure when, but in the next day or two, I believe. So what we're doing is not altogether different than what New York is doing, for example, where we are trying to create additional capacity. This means beds, this means equipment, this means PPE, this means staffing. Difficult to do. So the first place you surge are within the existing hospitals, because you have the ability to add beds, and the staffing is still challenging, but it's less challenging because you're doing it in the hospital. The second thing you do is you look at your Tier 2 facilities, those long-term acute care facilities that have capacity, those rehab hospitals and so forth. But at some point, we know that with the trajectory we're on, we're going to exceed those capacities as well. So we're looking to create medical monitoring capacity or step-down capacity. So these are individuals who maybe COVID positive, but they don't require an intensive care bed, don't require a ventilator, but they're not ready to discharge home either. And if we can get them out of those beds sooner in the actual hospitals, then we can increase that surge capacity of the hospital itself. And so we're going to be creating a number of beds, and we're looking at different options, not just in New Orleans, but around the state, but New Orleans first, because that is where the greatest need will present itself the soonest. And so that's what we're working on, and we will have more information about that.
The beds would be staffed by healthcare professionals, though? These are people who still need monitoring.
Oh, yeah. These are going to be doctors and nurses, healthcare professionals, and this is particularly challenging. You may know that I requested yesterday for I'm going to call them field hospitals from the federal government with staffing. So that would be 1,000 beds and staffing to meet the needs of 1,000 beds. We don't have an answer on either of those requests yet, but there are some different things that we can do via contract and otherwise in order to get the staffing that we need. But this is why we have been trying to source ventilators, PPE, I mean, you name it. And this is a challenging situation. And so I'm certainly want people to be mindful of it, but I want people to understand the direct relationship between our need to increase our capacity and the mitigation measures that we've implemented. That's why we're asking people to not go out and have contact with others when it isn't essential that they do so. So that we don't have more people than is absolutely necessary going to the hospital in the short term in order to consume what is going to be a precious resource. And that's going to be that hospital bed. It's going to be that ventilator. It's going to be the time and attention of a doctor and a nurse and a respiratory therapist and so forth. That's why we're doing what we're doing, is to minimize what's going to be needed on the other hand with respect to our surge capacity. Yes, sir.
How close is LDH to adding recovered patients to its dashboard?
You know, I want to let Dr. Bu answer the question. It's difficult because, well, first of all, I think our first case is 2 weeks and a day old, right? And so you typically have to go a 14-day period before, and then at one time you needed to have, once you were symptom-free, for I think 3 days perhaps, you had to have a test negative, and then at least 24 hours elapsed and another test negative before you're going to be put in the recovered category. I'm not so sure that's what is in place now, not just in Louisiana but around the country. We obviously, we're hoping and praying and working to make sure as many people recover as possible. Capturing that data has proven more difficult than most people would think is reasonable, and I'm one of those people, by the way. I'm not sure why it's been so hard, but I'm also not expecting immediately to have a large number of recovered people. But I think over the coming days and weeks, we will be able to show some data on recovered folks. But Dr. B, come explain that better.
I think that's exactly it. The challenge here is, first of all, the growth in our numbers. I know we keep saying it, but the growth in our numbers has been really tremendous. And we have a team who's focused really on, as we have a new case, reaching out to that individual, finding out the context in which they had COVID, anybody that they might be in contact with, giving them advice on isolation and things like that. That same team normally, if we were talking about a handful of cases, would be the team that would be following up to see if they're recovered. And when we're adding 300 cases in an evening, we just can't have the team deployed that way. So we've been looking at technology ways to get this information. Bare minimum, as the governor said, is sort of just using a time limit. We know that most folks that have COVID, their symptoms are going to resolve without needing medical attention. Most of the folks are not in the hospital. And so essentially, as we know about them, we could sort of set a time limit. We would like to have a little bit more information. More importantly, we would like to be able to support those individuals who are being diagnosed in the community. We know the strain this is putting on primary care providers to continue to give them advice as well. So we're looking at solutions right now to serve the more important purpose, which is continuing to give advice to the patients in the state. And we think that could also serve the purpose of giving us a resolved number.
And I learned something from Dr. Catherine O'Neill last night. She's an infectious disease specialist at Our Lady of the Lake here in Baton Rouge, and she was on the LPB program. With respect to COVID-19, people are most infectious early on during their particular episode with this disease. They can still be symptomatic and sick, but on the tail end of that, they are much less infectious and may not be infectious at all. And so what this means is people really need to take it upon themselves that when they first feel the symptoms to isolate. That is when they are most likely to be shedding the virus and to be contagious. So everyone, and Dr. Sanjay Gupta said this a long time ago, the easiest way for us to try to catch up with South Korea, who was way ahead of us in the testing early on, and the isolation, the quarantine, the contact tracing, is for people to behave today as if they have the coronavirus. And if we will do that, if we will just use that prophylactic measure, that mitigation measure as a proxy for the testing, we can flatten that curve. That is why we have implemented these mitigation measures. I can see this is a day where the questions are going to go as long as I stand here. So we're going to take a few. I'll go to the back of the room. Yes, ma'am.
Are you looking into any ways that independent contractors can get special assistance since they don't qualify for unemployment?
Well, we are, but what we need people to understand is because they're not employees, nobody has been paying into the unemployment fund for them. And statutorily, they're not entitled to the $247 a week benefit. However, we are working, for example, with the congressional delegation, and they are to be commended for their work because we believe that there will be some assistance, especially, and look, the bill is changing. It hasn't been passed yet, and it's changing, but we think that there could be some relief for those individuals in the third phase of the coronavirus relief package that we hope will come out of the Senate today and then get quickly passed by the House. There's a lot of good things in there for businesses, for states, for healthcare providers, for workers. And so it's my hope that that will happen. Obviously, I have my hands full here in Louisiana with what we're dealing with, but we are trying as best we can to analyze the legislation under consideration by every agency in the state of Louisiana so that we're leaning forward, and as soon as it passes, we know the relief that it contains for Louisiana and that we quickly access that relief for the entire state. Yes, ma'am.
Can you talk about the burden that's being placed on the Louisiana Workforce Commission right now as they are seeing unemployment claims through the roof, websites crashing, phones are busy, people are frustrated, and they need to get food on their table? Yeah,
and look, it is really tough. I mean, we have a call volume, a volume of people who are accessing the Louisiana Workforce Commission through the internet to apply for unemployment benefits, and we have a tremendous team at LWC led by Secretary Ava Dejwa. They're doing a tremendous work, but the volume has never been experienced before in the state of Louisiana. And I'm asking people to be patient. If you are able, wait. Don't try to do it between 8 o'clock and 4 in the morning and 4 o'clock in the afternoon. You can get on that internet at any time. You can call. They're working until 7 o'clock every night. So call a little later. But please be patient, but do be persistent. And one of the things that we've done is we've waived the week that you would typically have to wait between when you are applying or eligible for these benefits and when you can start to receive them. The other thing that I have waived is the search requirement, so that typically in order to continue receiving these unemployment benefits, you have to be out and about looking for a job and documenting that and proving that. So we've waived those things, and for the benefit of employers out there, this period of unemployment, these claims are not going to count against their experience. So that's going to be helpful to those employers. Correct?
Have you secured the VA hospital? You had asked the president. I was thinking specifically asking.
We don't, and look, that situation sort of. We thought there would be an opportunity there. There's not going to be, because quite frankly, the VA doesn't have much capacity either. It has a number of patients, COVID positive patients that are consuming demand that exceed their normal, and so that's just not going to be a workable solution for us. Yes, sir.
Between food bank shortages that you mentioned in your letter this morning, more difficult access to school lunches, and now trouble with the economy, what are the odds people go hungry in the next few months?
Obviously, we're working very hard to prevent that from happening from a variety of perspectives. One is the logistics necessary to keep agriculture moving in the country and in our state has been preserved. Those are essential businesses. The logistics chain, in order to make that happen with respect to trucking and warehousing and food delivery, the grocery stores themselves have been deemed essential infrastructure and workers essential. We are still working with our school food service offices. The Beth CNO is doing that through the Department of Education to try to keep feeding sites open. We are looking at new opportunities that we may have and trying to get waivers necessary to fold in additional entities on food service and perhaps even restaurants, and it could be a way that they could keep their doors open and keep some income coming. But all of this is very serious. And look, I am mindful that on our best days in Louisiana, 25% of our children were challenged with nutrition. These are not our best days, and so we need as much help as we can get in this area, you know, we're mindful of these challenges, and we are certainly doing what we can to implement strategies that are going to help address nutrition. And by the way, nutrition is very important throughout life. The other area where it's most important is for elderly people who may be homebound. And so we're greatly ramping up food delivery, meal delivery through Meals on Wheels and Councils on Aging and those sorts of programs as well. So I'm going to take one more question, and that's going to be it right here.
You mentioned earlier you were encouraged by what you've seen so far from the public and from residents following your stay-at-home order and other restrictions you put in place. What, I guess, specifically have you seen that has made you encouraged? I know it hasn't been around for super long, just today. But.
Yeah, well, I'm seeing leaders, political leaders, business leaders. I'm seeing religious leaders come out and embrace and endorse the measures that we've taken as being necessary, encouraging people to comply. We are seeing much more compliance, and this is relatively anecdotal, and you probably are doing much more riding around than I am, but we don't see the traffic out on the street that we were seeing before. And so just all of this, and in talking with other elected leaders, mayors and so forth, I know from speaking to the mayor of New Orleans, she tells me she's seeing a lot more compliance, for example, in New Orleans. And so we still have a ways to go, however, because I know we're not perfect, and I know that there are still individuals out there who maybe haven't taken this seriously yet. I implore them to do so. We're running out of time. Again, everybody has a role to play, and it's critically important everybody play that role, and it is to comply with these mitigation measures, stop unessential travel, stop making contact with other people, and just do it because you're concerned about your neighbor, you're concerned about your brother and sister, and it's just important that we do this. Look, I want to thank y'all for coming out today. We will let you know when the next press briefing is going to be. I will finish as I typically do, and that is I'm going to ask everyone to work as hard as you can so that we can flatten the curve as soon as possible. And for some of you, and even though I know there's a lot of anxiety out there, the work I'm asking you to do is stay at home. Stay home, stop the spread, and save lives. And I do encourage everyone to join me in prayer so that we can get through this as soon as possible and in the best shape possible. Thank you all.